Started?
Yes.
Okay. So good morning, good afternoon, and good evening. So welcome to the 66th UNNGO CSW parallel event titled Achieving Work-Family Balance and Empowering Working Women During the COVID Pandemic. And before we start our presentation, introductions and presentations, we just have some general reminders and logistics. I wanted to remind the participants and give a rundown. So as a general reminder, we ask that all participants remember to mute your microphone. That would greatly be appreciated. And so there's some last minute logistic changes. So originally, we're going to do the Q&A, reserve like the questions till the very end of the presentation, but due to the constraints of our first panelist, so we're going to finish the first panelist presentation, and then we'll immediately have the Q&A section. So feel free to type in any questions you have in the chat box, and then we'll raise that when it's time for the first panelist Q&A session, and then we'll resume back to the rest of the panelist presentation. And then if you could just reserve your questions at the very end, but feel free to type it in the chat box along the way, and then we'll make sure to raise it to the corresponding panelist. And a reminder for the panelists, you have to try to make sure your presentation stays within 15 minutes, and our organizers at the 13th minute mark, they will provide a gentle reminder that you have 2 minutes remaining. And before we start, can we ask everyone, all the participants, panelists, to show your video so we can have like a virtual group Photoshop group photo before we begin? Make sure to smile.
Okay, ready? 1, 2, 3, say cheese. Okay. Yeah, very good.
Oh, we're good to go?
Yeah.
Okay.
Yeah. Yes, thank you.
Okay. So we'll go ahead and start with the introductions. Before we start the session, I just want to provide a brief introduction of our organizers today. Remember to mute your microphones, please. Okay, so the first represented organization is Hand in Hand Association of Taiwan. It was founded in 2017, and its outreach and advocacy integrates CEDAW framework at communities such as campuses and prisons. And its workshops center on themes such as preventative strategies on teen pregnancy, respecting body boundaries, gender stereotyping in the media, etc. And the second representative organization is the Office for Gender Equality Taipei City Government. On the eve of Women's Day 2014, the Taipei City Government launched the Office of Gender Equality. The office directly reports to the mayor's office and has been on the mission to promote municipal policies on gender equality, general planning, and coordination and oversight of related policies, legislature bills, plans, and work reports. So again, today's parallel event is titled Achieving Work-Family Balance and Empowering Working Women During the COVID Pandemic. The pandemic was not only a public health crisis, it also compounded a crisis onto deep, long-standing employment, economic, and gender inequalities. Most women not only work at informal sectors, but carry a heavy burden of caring for their families. Women are bearing the brunt of this crisis. The session will discuss women's working situations and family relationships during the pandemic in Asia and Europe, including changes at home and at work women have experienced, measures or programs by Frontline entity and NGO, and policy-oriented progress and solutions. So without further ado, our first panelist is Miss Eileen Bruiser, and sorry if I have any mispronunciations, I'm American. She is a policy advisor on gender equality for the European Trade Union Confederation. And prior to this role, she obtained her master's in gender studies and sociology, and then building upon her education, she continues to focus her work on gender and social policies in Europe. Her presentation today will provide an overview of the gender impact on women in Europe from the COVID crisis and highlight specific disparities that have worsened during the COVID crisis. So please go ahead, Ms. Bruiser.
Thank you so much. You pronounced the name almost perfectly. So it's Aline Bruiser. I'm actually from Germany originally, but now I am speaking to you here from Brussels in Belgium, where the headquarters of the European Trade Union Confederation are. Maybe just a brief introduction, because Helena has already very well summarized what I'm doing here, but for those of you who may not know the European Trade Union Confederation, so we speak with one single voice for all workers in Europe, actually, and we have 92 national organizations that are members of our confederation from 39 countries across the European continent. So really a broad church across the whole continent, and we try to obviously defend workers' rights and also make sure that every worker in Europe has a fair pay and has decent working conditions. That's our aim. I will just share my screen in order to share with you the PowerPoint presentation I had prepared. First of all, obviously, a big thanks to Hand in Hand Association of Taiwan and the Office for Gender Equality of Taipei City for inviting me to this very timely and very interesting event. I am very lucky and excited to be here with you digitally today. And apologies because, as Helena has mentioned, I have to leave earlier, so that's due to my calendar issues that we had to shift the program a bit. And thank you to the organizers for their flexibility. So I'm going to start right away with a quote here of the ETUC Deputy General Secretary Esther Lynch. I will read it. So if anyone believed that gender equality was close to being achieved, the pandemic has laid bare the realities, systemic inequalities that are built into numerous aspects of women's lives, from pay, employment, and work-life balance to safety at work and in the home, have been reinforced. I apologize to start this presentation with such a gloomy quote, but it is accurate in one sense, because I think the COVID pandemic and all the repercussions that came with it have really shown us how fragile a lot of wins have been and how hard we have to fight actually to really reverse this trend of backtracking even more. So we have to fight for past achievements and really obviously also use this crisis and use this triggered by this pandemic to make a giant leap forward and to make sure that that gendered inequalities in all areas of life actually go back to the past and don't accompany us to the future. So maybe a bit more in detail, we know it's very well documented by now that COVID-19 has exacerbated inequalities between men and women, and that we really have a threat here to reverse past progress. Maybe regarding very concrete figures. So we know also, and here I'm quoting a study done by Eurofound, which is a European Union agency, that low-paid female workers have been hit most by job losses. And it's very, very interesting to see, for example, that during the financial crisis of 2008 until 2010, it was rather male-dominated jobs actually that have been under threat, and more men that lost their job. And the COVID crisis has really triggered massive job losses for heavily feminized sectors, such as everything to do with accommodation, tourism, hospitality. So these were the sectors most hit. And we all know that that these are sectors that are heavily feminized. So we have here a first glimpse really, and it's as said, well documented, that women and specifically low-paid women bear the costs here of the COVID-19 pandemic. Also regarding work-life balance, again citing Eurofound, we know that women did the bulk of care work or did more hours on unpaid care work in the home during the COVID-19 pandemic. So I think it was 35 hours per week for women and 24 hours spent by men on care work, meaning caring for children, doing domestic work such as cleaning, cooking, grocery shopping. So we see a disparity here that has been there before, obviously, and that's an important point. So the COVID I mean, basically the COVID pandemic, it's not news that women do the bulk of care work, but it just has exacerbated and made it a bit more visible that these systemic inequalities are there and need to be tackled. And maybe a very, very, maybe the worst effect actually of the COVID-19 pandemic, and it was for me also as a feminist when COVID hit, I was like, okay, what's with all the women who are victims and survivors of domestic violence, being at home with their partner, not having any reason actually or any rights to leave the house even. So we know that there has been an increase in intimate partner violence, in domestic violence, and also in violence, in gender-based violence and harassment at work. And here we think, for example, of all the people who still have person-to-person jobs where they speak, for example, with clients, because we know that, for example, women workers had to enforce the sanitary rules, so the COVID rules. They had to remind the clients of wearing a mask, for example, and then they were subjected actually to very, very aggressive behavior by clients and even physical threats. So that's another a very dark reality that the COVID-19 pandemic has laid bare. Maybe just to give you an overview what we are here doing at the ETUC. So basically, with COVID, there came also the idea of having like a roadmap of our future work for the ETUC Women's Committee, where we have sort of a 10 points plan, which is called the ETUC Women Workers Manifesto, to make sure that the recovery that comes after the crisis and that has been triggered now, that this recovery actually leads to a more gender equal world, not even only a world of work, but a world in general. So at the heart, and I will not go through every point in detail, but obviously we want more support for trade unions so they can spearhead the fight for gender equality. That means that we need a massive boost for collective bargaining, because we know that when women workers sit down together with the employer and negotiate for a better deal, that's where valid solutions actually come to light. So that is a very, very important point. We want paid justice for essential workers, because we also know that the workers who showed up during the pandemic, the cleaners, the carers, the cashiers, we all still went to the supermarket. And normally the people, at least here in Belgium, the people who are cashiers, who enable us to pay food, it's women workers, and these people need to be properly paid, and the value of their work needs to be finally properly recognized. And also end stereotypes, which is obviously a massive issue, but we need to leave like these gender roles behind that are also perpetrating basically gender-based violence. So it's really a big plan, and we haven't achieved everything yet, but it's a bit our roadmap for our future work. Maybe very briefly, speaking of work-life balance, as this is also the very timely topic for today's event, we know that, for example, telework is a gift as it is a threat as well, because we know that, for example, women workers who have taken up telework do this as a sort of coping strategy to still do the bulk of care work at home while teleworking. So there are like good things about it, advantages as there are disadvantages. So maybe a quick throwback to the Work-Life Balance Directive, because this is a piece of legislation at European Union level that was adopted in 2019. And the Work-Life Balance Directive it gives some new rights and introduces some minimum standards actually on how to achieve work-life balance in the European member states. And why do I speak about this today? Because it sounds like old news, but the deadline for transposition is actually this summer. And that means that member states have now 2 years' time to put everything that was in the directive in place and to make sure that everything is properly transposed. So what does the work-life balance mean? Again, it's minimum standards. We have, for example, as a new right, paternity leave, like 10 days of paternity leave only for fathers, which was a complete novelty in 11 member states who didn't have any specific leave arrangements for fathers in place before this directive came to light. We have a carer's leave of 5 days a year, a carer that might care for a vulnerable person in their family, maybe a parent, maybe a sibling. And obviously 5 days a year is nothing. However, it's very important that at European level, it was recognized that care work is not only for children, for example, but there are many ways of doing care work inside the family, and that this is obviously a burden that lays on the shoulders of women workers in particular. We have minimum standards on flexible working arrangements, meaning that employers have to offer a certain limit of flexible arrangements to enable people to do care work. And we have a parental leave of 4 months in total. 2 months of those are paid and non-transferable. And the whole reasoning behind the Work-Life Balance Directive was obviously also to create incentives for fathers or for second parents to be more engaged in care work, as we all know that normally is women who do the lion's share and mothers who take up the lion's share of care work. And then the next topic I would like to speak briefly on, and I know I'm sure someone is looking at the clock, so I have to maybe race through this a bit. But I mentioned before the pay justice for essential workers and in general equal pay, because in Europe here we still have a gender pay gap of 14%, which is incredibly hard to get rid of. Even me, because I'm 30 years old and I still have to grasp every day that there is still a gender pay gap, which is actually crazy. And obviously the fact that there are women workers in highly feminized sectors who are doing incredibly essential work and whose work is actually not as much paid as it should be. And again, coming back to COVID, the pandemic has really shown us how essential their work is. So what is the ETUC actually doing? What are we doing here to make sure that the gender pay gap is completely eradicated, and to make sure that that essential workers get the pay they deserve? We have a directive here that is now being negotiated. So the European Commission last year actually proposed a directive to close the gender pay gap and to finally enforce equal pay for work of equal value, which is really a key concept. I won't lead you through the very details of this directive, but it's currently being negotiated, and we hope it's going to be adopted very, very soon. But it's a very, very important step because, again, a directive has to be transposed by member states, so they have to put everything in their law system, sort of at member state level. And this directive is incredibly important, as it will finally, hopefully, enforce equal pay for work of equal value. And that means that actually employers have to make sure that jobs are properly compared, and that many characteristics of jobs predominantly done by women are finally actually seen and taken into account when it comes to deciding how big a wage a woman worker should get. So this is very, very important. And here I've put a little visual here in the PowerPoint presentation, because what is so important about these gender neutral job evaluation schemes is that obviously all characteristics are seen. And for example, a childcare worker, you normally don't think of the fact that this person, a childcare worker, has to do heavy lifting, that this person is exposed to noise, to ergonomic hazards, to psychosocial risks. So all these factors are part of a job, of an everyday life of a childcare worker, but it's not recognized as such, where we have in heavily male-dominated sectors, for example. We have a much better view actually on specifically on hazards or on risks that a worker in male-dominated sectors is exposed to, and we don't have that with female-dominated work, because we still operate, unfortunately, with this notion that it's innate for a woman to be able to care, that it's like innate for a woman, or like it comes automatically to a women worker to do emotional care work. And with this directive, we hope to change that, and we hope that it's now then set in stone that every employer has to check for every job. Okay, what does this job actually mean? And then that the wages increased accordingly. And also briefly, because I mentioned collective bargaining before, and we are doing now, for example, just to give you one example of our actions, we're doing a project that is called New Frontiers for Collective Bargaining, where we specifically look at how our affiliates, like our trade union that are a member of the ETUC, have put in practice equal pay for work of equal value in their collective bargaining strategies. meaning did they sit down with the employer and did they negotiate a way of implementing a gender neutral job evaluation schemes, for example, or pay transparency measures, and how did collective bargaining help, and what are the best strategies to enshrine this in collective bargaining agreements? Because we know, and that's also what research shows, is that for workers who are bound by collective bargaining agreements, actually the gender pay gap is much lower, and it's really the adequate a measure here to finally close the gender pay gap and to end the undervaluation of work done by women. Another priority.
Sorry. Sorry for interrupting. You have 2 minutes left.
Okay, perfect. That should be all right. Thank you very much. So another priority here is to stop violence against women and girls in all its forms, because I already spoke on intimate partner violence, domestic violence, but we know there is sexual harassment and violence also in the world of work. And we know that actually the more equipped an employer is with sort of digital solutions, the bigger is also the risk that this employer might use these digital tools and solutions to actually surveil workers and to basically intrude into their privacy. So that's something we are working, or we are looking very, very closely on, because there's a risk of surveillance and there's a risk of intrusive employer management here. Importantly, what we have seen also, coming back to the repercussions and the consequences of the COVID pandemic, we have done a little survey ourselves because we wanted to know, okay, with telework, with all the COVID restrictions, how did you find, what effect did it have on violence against women? And we have 84% of our respondents that said that employers had not updated their policies to address online harassment associated with telework. We have 84% of respondents that thought that their national laws were not strong enough to tackle violence and harassment at work, including online, and or 83% of respondents that did not believe that their country's laws to tackle violence and harassment at work, including online, were adequately enforced. So even if member states have great laws written on paper, they're not adequately enforced. And these are all signs that show us that we really have to step up our efforts here to make sure that women workers are protected at work, also from third-party violence, as I mentioned, for example, aggressive clients a bit earlier in my presentation. And it's really an absolute must that, again, solutions are found via collective bargaining agreements. And maybe depending on the questions, I can also mention some good practice agreements here. But violence and harassment at work is a very serious issue that we're working on as well, and that has been exacerbated by the COVID-19 pandemic as well. Lastly, before I close, I wanted to share with you our little social media campaign we did for International Women's Day, and it's a bit the gist of my whole presentation, because the ETUC Women's Committee has chosen this motto, which is organizing for a better deal. And that means women who join together in their union, who sit down with employers, who negotiate for a better deal. That's really the future, and that's really how we make workplaces more gender equal, how we achieve work-life balance, how we achieve that all women workers are safe at work, how we achieve equal pay, and to end the undervaluation of work done by women outside and inside the workplace. So let's do that. Let's all join a union and organize for a better deal. And that is actually my closing remark. And therefore, I hope I've been in time. Thank you very much for your attention.
You for your presentation, and I think it's actually very powerful to start with your Deputy General Secretary's quote, because it highlights, even though it's grim, it highlights the urgency of if we don't catch up with the progress, we are very much in danger of derailing the progress that we already made, and actually also even backtracking the progress. And so thank you very much for also sharing powerful EU framework that your organization is able to leverage to impose on all the member states. And so that's very encouraging. So I guess let's see, I don't see any questions in the chat box, so I'll go ahead with the questions that I've drafted ahead of time. So I think from my perspective as an American, there's a decline in union and bargaining units of being a powerful source to make sure that there's to decrease like the gender gap regarding their pay. So I was wondering if you could, I guess, like share some like encouraging examples that, you know, unions or collective bargaining played a significant role of women's rights in the workplace during the COVID, some of the lessons you learned during the COVID time.
For sure. Thank you very much for that question, Helena. So indeed, and referring to the project that I just briefly presented, so New Frontiers for Collective Bargaining, we are doing actually the same thing at the time. So we are looking into all our federations and all our affiliates' work, and we're trying to find the best collective bargaining agreements. And just to give you maybe a brief answer on everything that pertains to equal pay, we have very, very good practice cases, for example, from Belgium, where the unions have also sit down with the government and jointly formulated gender neutral job classification criteria, so really to set in stone, as I presented earlier, how a job is evaluated and with which criteria this should take place. So there are very good examples from Belgium, as well as from Iceland. Iceland is really the equal pay for work of equal value champion. Actually, they have managed to put in really mechanisms that are completely free from gender bias, and they have achieved a great deal there. So if you want to have a best practice example, I would suggest to look to Iceland, and the Icelandic unions have been really trailblazers here. The same goes, we have a very high engagement also in the UK with everything that pertains to collective bargaining agreements for equal pay and to end the undervaluation of work done by women. And also I would advise to look to New Zealand and Canada, because the unions have been incredibly active there as well, and made sure that as pay transparency measures as well as measures on equal pay for work of equal value have been negotiated in collective bargaining agreements. And maybe very lastly, and I'm happy to put that in the chat if I can, we have here, yeah, you can see that. So this is an ETUC report called Safe at Home, Safe at Work, with a selection of collective bargaining clauses from all European countries, with really innovative solutions that unions came up with to make sure to end workplace violence and harassment, and also to really respond or to bring responsive solutions to the table for domestic violence, for example. So we have here collective bargaining agreements that contain clauses, for example, on leave, a special leave for women who are targeted or victims of domestic violence. We have clauses here, for example, for training, also for union or for HR experts who should be aware of the issue of violence and harassment at work. And it's really an encouraging example that shows that unions came up with a lot of strategies to make workplaces safe and to really respond to the phenomenon of gender-based violence in general. And I'm happy to put the link in the chat so you can have a read yourself.
Yeah, that would be great if you could share like the link. You mentioned, yeah, like specific examples with gender violence, and I think you weren't able to go into details also, like the dichotomy of like, like having the flexibility to work at home, but also like having increased harassment like through telework, even when companies have policy, whether or not they haven't like fully updated or integrated telework policies that address like workplace harassment online. So I was wondering if you could also like highlight some like best practices or practices regarding like collective bargaining on like how do you balance like the risks of like surveillance, flexibility, and then but also like tackling gender-based like violence like online.
Yeah, thank you. So we're actually in the ETUC, we are very much in negotiation, because we are a social partner as well at European level, and we're negotiating with the employers on precisely this issue as well. And I can maybe say that from an employer's point of view, it's not really an issue, because we also know that productivity rose during with telework arrangements. And as I mentioned before, I think it's really seen, unfortunately, by women workers or by carers who are women as a coping strategy, so they can do both at the same time, which is obviously not possible. And for an employer, it's really sort of a low-cost solution to a problem that should be properly fixed, and that must be properly fixed with really work-life balance policy and legislation in place. For now, we are still waiting for the breakthrough with employers, so to say, but we really underline and stress the fact that a lack of really fixed solutions and arrangements for telework is really a problem. And maybe to cite again the Eurofound findings that I've mentioned before, they found, for example, a higher risk of depression for women in telework with children. So the effects of this are massively gendered in the sense that a mother who has to do telework and care for children at the same time, there are massive effects on mental health. But in my view, it's still a bit under-researched for the moment. So there are a bit of like hard facts, hard findings that are lacking, that would also make employers understand that this is, even in their reasoning, sort of, it's not a sustainable solution to let people sort of work at home, do care work at the same time, be productive and overproductive even at the same time. So that's really not a solution, and we're trying to negotiate ourselves how to make this better. And maybe one last thing, because I've read an article recently on something that is called a mouse mover. I don't know if you have ever heard of it. So it's like a little robot thing that moves the mouse on your computer so that the employer sees that you're still active, because when the mouse is inactive, the employer might think that you were, I don't know, having a coffee in the sun or chilling with your friends or whatever. So it's crazy. I mean, it's just, and this is just one very simple example of surveillance techniques actually used by employers, and we all have to be very, very mindful of that and keep a very close eye on what sort of technologies and what little green or yellow lights next to your name in your Outlook inbox and all these things. Like, I think there are many techniques already in place, and we have to monitor this very, very, very closely.
See that there's a question, and from the participants, is that correct, Dr. Yan?
Hi, this is Xiangruan Yan. I like it, Mrs. Brucer. Could you elaborate more about how about the women in formal sector? How they, are they included into the collective bargaining process, or how they do it? Thank you.
I'm not sure I got the question. In the informal sector?
Yeah, informal sector.
Yeah, I mean, that's a very good question. And it's obviously for unions, it's a demographic or a group of workers that is also, I wouldn't say hard to organize, but there are there are barriers in place for unions actually to get in touch with workers in the informal sector. And I'm specifically thinking of people who are doing informal care work, so to say, because we have this phenomenon here in European countries of live-in care workers. So, for example, I'm from Germany, so there are many women from Poland actually who are doing care work informally without a proper contract in place, without any contributions paid to social security. So it's really an informal economy in that sense. And all these people, so for example, Polish care workers in Germany, when the pandemic hit, they were just stuck. Like, they couldn't get back to Poland. They were just stuck being live-in carers, but then really full-time, in the sense that they couldn't even get back to their neighboring country. So I think it's an incredibly relevant question. And I know that once they, for example, Polish care workers that then got back to Poland, many of them quit this kind of job as well, because it shone the light also on what it does for you when you have such a low level of protection. And the problem with these kinds of job and arrangements is obviously that we have an underfunded public service also, because when you have a low-cost live-in care worker, and that is obviously work that also families tend to spend who are not in the highest earning positions in society, because they cannot afford quality care. And here, I think it's really a problem also of the equipment of the public service sector and the affordability of quality care work that has really been shown also during the COVID pandemic. And indeed, I think our affiliates obviously have strategies in place to address these workers, to contact them, to make sure they organize themselves in unions because they are they're really the most precarious and the most vulnerable workers, and I think COVID has shown that. So maybe to follow up and maybe send you a more detailed answer by mail, but it's a very valuable and valid question.
Thank you.
I think that's all the questions we have, and definitely we'll reach out if we think of any lingering questions, and we want to be respectful of your time. But thank you again for being with us and sharing your European perspective, which is very crucial to exchange. So thank you again for your presentation and your time. So we're gonna...
Thank you very much for having me. Sorry. Thank you.
Thanks. So we're going to go ahead for our next panelist, which is Dr. Xiangluan Yan. Dr. Yan continues to be a social justice advocate and practitioner after being a professor for over 20 years. Currently, she is the vice chair of the Taipei City Gender Equality Commission and an advisor of Hand in Hand Association of Taiwan. Her presentation today will provide an overview of the COVID gender impact on labor markets in Taiwan and identify gender responsive policies. Dr. Yan?
Okay, I didn't open my mic. Good morning, I think. Okay, it's a privilege to be here to share the topics on how the COVID-19 gender impact on labor market in Taiwan. And first, I would like to share some globally market, but since Aline Brewster have talked about some globally labor market, I'm going to just briefly to mention. Globally, women have been disproportionately hit in terms of job losses and employment. So women's role in labor market has been the reserve army of labor. It refers to unemployment and underemployment in capitalist society. So globally, women have been disproportionate hit is really, we imagine 4.2% versus 3% of men. So that's globally. Regionally, employment trend in America, women's employment declined by 9.4%. Oh, I'm sorry. In the average states, despite favorable prospects for women's employment in 2021, women continue to be 5 times less likely to be in employment than men. In Asia and the Pacific, men's employment is projected to surpass its pre-crisis level, while women's likely to remain below its 2019 level. In Europe and Central Asia, women have lost 2.5% of their job due to the COVID and are expected to recover just 0.6% of them in 2021. It's interesting, in Africa, women's employment growth in 2021 is expected to more than offset the job losses resulting from COVID-19. However, job equality and dependence on the informal economy remain major concern. That's why I raised the question to Mrs. Aline Brewster, because a lot of women concentrate in the informal economic. So what is going to happen to them? So the gender gap in job quality persists despite the employment rates. Okay. And what happened to women in Taiwan? If we look at the employment rate by January 2022, it's really updated one. 3.67% for men, 3.55% for women. So there's no significance difference. So no significant difference. Then I try to look at other indicators, such as unpaid leave, gender difference in application for bailout, housework for women in Taiwan. So who took unpaid leave? According to November 2021 statistics indicate that total household implementing unpaid leave were 36,182, consists of 16,143 men and of 20,039 women. So it's a 45% compared to men 45% and women 55%. And then again, it's really consistent with what the first panelist speaks. They were most likely employed in the accommodation and certain catering industry, in the support service industry, and in wholesale and retail industry. So that's a low-paid job, especially for the many women working in, this is a feminized sector, family industry, okay? So globally, there's a total 1.6 billion informal sector worker, 76% of informal worker globally, such as accommodation and food service. Then again, it consists of 42% women versus 32% men. So unpaid leave, I thought that's another indicator for the impact. And these items of application for bailout with a large gender difference between men and women, larger than 18% in Taipei. Even I need to say is really only the short period of time. You can see it's June 1st, 2021 to July 31st, 2021. And look at the market in rate. Labor bailout negotiate to reduce working hours, 减工时, is 68% versus women for women, 32% for men. And work industry with the ease, 安心及时上工, again, that's a 60% for women, 40% for men. And I would say that it shows that women continue to bear the brunt of unpaid care work. And this has led women who remain in employment to cut down on paid working hours or to extend their total working hours. So the next, I'm going to share some, well, the IMF confirms, a new study by IMF confirms that pandemic has a huge impact on working mothers and the economy as a whole. Especially women with young children have become one of the biggest victims of the economic lockdown. So economic lockdown is threatened a lot of people, especially for women with young kids, young children. In short, the professional world, many women who had largely shouldered the burden of a child care and household chore, even before the pandemic, are now forced to leave their job or work few hours. According to research by UN Women, before COVID-19, women spend average of 6 more hours per week than men on unpaid childcare, but the gap widened to 7.7 hours during the pandemic, equivalent to women spending 31.5 hours per week, which is almost an extra full-time job without pay. And this reduced women's contribution to the economic. And what happened to Taiwan? According to statistics in May 2017, a family housekeeper's wife spends 3.81 hours per day. That's per day, not per week, which is more than 3 times that of her husband, 1.13 hours. And the working woman in a dual income family needs to do housework every day for housework is 3.26 hours compared to how the wife now working outside, 3.81 hours. That's one half hour is per day. So only 30 minutes. So which is a 2.7 times of the 1.23 hours that the husband needs to spend for housework. So in 2019, the average daily unpaid care work of a married woman over the age of 15, including cohabiting, was 4.41 hours. So compared to 3.81, it's increasing. That's a per day. It's not per week. An average daily unpaid care time of their spouse, including cohabitant, was only 1.48 hours. So you can see the difference. Again, and now I really like to propose a gender-responsive job recovery policy that's by ILO, International Labor Organization, proposed. I think financial support for employment mothers struggling to make ends meet and support their family is crucial. And childcare school government should include reopening school among their vaccination priority. The provision of a childcare service capital to enabling mother to participate in the labor market. Government should prioritize the reopening school and childcare center, reduce the likelihood of further school closure. That's the first one, first two. And the third and fourth is a reconfiguration policy, 重新配置. Mothers and women in general are more likely to have a job that require face-to-face interaction. Then COVID pandemic has destroyed too many of these jobs, and some of them will never come back. And financial opportunity, that's really worth to try. That's a digital gap. Expanding access to financial service can go a long way for women to start maintain their own business. To this end, the potential of technology must be explored to achieve greater financial inclusion, especially in the developing countries, such as we are using webinar. If they don't have this technology equipment, it's really hard on them. That's if we talk about the human rights, the equality, the opportunity equality, then equity to access, that's a difference. That's financial opportunity is refers to this. How we can making gender responsive policy work? We do. I just pick up a couple of them and we try to do some comparison. Investment in child care resources, we do have that policy. However, the Minister of Labor explained that employees are required to grant leave, but employees have no obligation to pay. Then that is similar to personal leave without pay, showing the support for caring in our law is still insufficient. Again, more than 90% of the primary care workers in Taiwan are women, and the majority of foreign care workers, domestic workers, are women, migrant workers. Several family members of the nurse were also infected. The majority of healthcare workers are women as well. And I think later on we have one panel from Nursing Association. They will talk about this. The closure of school and childcare service due to the lockdown has increased the need for care within family. Another subject I like to bring up, working from home. It looks like working from home is good, but from invisibility to decent work. With the spread of a COVID-19 pandemic in 2020, large proportion of workforce shift to home working, join hundreds of millions of that workers who had already been working from home couple decades. And I estimate 147 million women and 133 million men work from home in 2019. with women accounting for 56% of home-based workers. The possibility of women to work from home is much higher than that of men. Then again, I would like to remind everybody, home workers are a heterogeneous category whose members range from impoverished industry home workers to highly skilled teleworkers, but all must deal with the implication of working from home. And what are the benefits of homework? What are the risks? The remote work model has made many companies think about how they will operate in the future, and the business world has begun to discuss the impact of remote work on women. For female, middle, and upper level executives, the flexibility of a remote work allows them to be able to balance family and work. Is that true? It's worth noting that telecom and computer programming related industry have benefited from remote work, and the beneficiaries are also many men, much higher than women. You can see that numbers. And again, really the end, I like to propose the government's role. Due diligence, that's the government's role. Government have a leading role to play in guarantee the protection of home workers' rights in cooperation with worker and employee organizations where they exist, associate of home worker and of their employee. It's a time for government in cooperation with the workers and employee organization to heed the guidance, conventional number 177 and recommendation number 184 and work together to ensure that all home workers. Again, the really last sentence I like to try to bring up. Policy response to prevent women from disproportional losing job and income during the emergency. We should have an urgent policy measure. And secondly, to improve the quality of job as well, such equal pay for equal value of work. And the urgent policy measure we need to really focus on to balance the gender-specific effort of the COVID-19 crisis and create the condition to support the creation of decent work for women. That's the end of my presentation. Thank you.
Thank you, Dr. Yan, for your presentation. From starting, I appreciate you starting from like the global perspective and then bringing in the Taiwanese perspective, but then also really drilling into the numbers, like what do they actually mean, and pointing out like the most vulnerable populations, such as, like most of the care workers in Taiwan are actually like migrant female workers. And then also, which something that Ms. Bruiser has also highlighted, which is like the digital divide, right? Is it really safer to work at home with like potential like domestic issues, but also online teleworking harassment, and the gender divide that have benefited teleworkers more for men, but less for women. But lastly, also focusing on the importance of having gender responsive policies to address the urgent need of the disparities that women are facing. So our next panelist is Ms. Tiffany Hong, and Ms. Hong is a researcher at the Office for Gender Equality, Taipei City Government. She has devoted herself to issues of women's rights in medicine and public health, as well as protecting females from sexual exploitation. She worked in NGOs for the past decade prior to serving in the government. Her presentation today will provide gender equality best practices from the public and private partnership in Taipei. Please go ahead.
Good morning, good afternoon, and good evening, everyone. I'm Tiffany Hong, a researcher from the Office of Gender Equality, Taipei City Governments. Today, I'm glad to join this virtual forum on behalf of the city governments. And my speaking topic is best practices for achieving work-family balance from government and enterprises in Taipei. I'll share instances of how enterprises in Taipei and city governments assist their employees during the COVID-19 epidemic, and based on Taipei City Workplace Gender Equality Index Certification Initiative and other ongoing policies. And this is outline for my presentation. First, I will go through statistics on women's labor participation and change of unemployed populations in Taiwan to briefly give an overall picture and gender differences on the issue during 2019 to 2020. Then I'll move on to the Taipei City Workplace Gender Equality Index Certification Initiative and quickly introduce you what indicators are included. The very first 2 years of running the initiative happened to meet the outbreak of the COVID-19. We found some performances by awarded enterprises did very well in helping employees keep balance between work and family, and which is worth of learning. And Taiwan central government and Taipei city government also released policies to ease negative impact brought by the pandemic from gender perspective. I will share the best practices with you, and finally we'll come to my conclusion. So before discussing the impact of the COVID-19 pandemic, let us first see female labor force participation rates by age globally. This is a graph of female labor force participation rates by age in 5 countries including Taiwan, Japan, Sweden, and United States in 2020. The rate climbs up to the peak at the age of 25 to 29 and turns down in most of the country except for Sweden. As for Taiwan, the red line you can see here, the rates of age group of 25 to 29 reaches over 90%, stand out among all others, but it goes down rapidly after age of 30 and even becomes the lowest one after age of 50. It implies that as women move into childbearing age, and that decreases women's participation in labor markets, which is what is more, once women in Taiwan of that age group leave labor force market, they seem more likely to stay out of it ever after leaving. The situation is very worse for us. Let's particularly look into the COVID-19 pandemic's impact upon labor participation by gender here. This graph shows change of unemployed population after the burst of the pandemic in 9 countries around the world. The pandemic does cause unemployed population increasing, but the issue is not the same for women and men. Although the growth rates of employed population by gender varied between countries, we can still find that in countries or areas where the COVID situation was the most severe, like Hong Kong and United States, the growth rates on women is much bigger than that of men. In Taiwan, the same thing. Although the gap between women and men is only 2 to 3 percentage points, growth rates of employed women between 2019 to 2020 is the biggest by comparing with the past 5 years. In short, pandemic resulting in women suffering more from losing job in Taiwan and in some other countries. However, no matter before or after the pandemic, women's labor participation dropping down and not coming back is always such a big loss to the society and serious issue to the governments. To tackle the problem, the government has launched a series of measures and policies. They are what you can see on this slide. including assisting measures for women returning to workplace, labor inspection measure project on gender equality in workplace, and so on. However, after years of implementation, the issue does not make obvious improvements. The Departments of Labor, Taipei City governments therefore proposed to do it another way. The departments believe that if we want to change rigid workplace culture, we should not only rely on regulations or policies without giving enterprises any incentives. Then the government should do something different and make changes happen first. That is, the government needs to change its mindset throughout the whole processes of promoting gender equality. In the past, the departments only serve role as law enforcement, punishing enterprises which violates the laws or regulations. It formed an obscene relationship with enterprises. To change the culture, the department tried to turn it into mutual collaboration. It designed a mechanism as well as a guideline to assist enterprises. This is how the concept of the Taipei City Workplace Gender Equality Index Certification Initiative was given birth in the very beginning. Starting from 2018, before the initiative was officially launched, the departments conducted several orientation sessions and challenge camps on the index. At challenge camps, representatives from different industries was asked to review the gender-related performances and situations in their own workplace. By doing so, they knew more about their strengths and weaknesses based on the indicators. If they found certain indicators hard to achieve in the self-review process, they could provide feedback to the departments, discuss together with the departments, and see if there is any solution to the issue. All the feedbacks would be brought back as a valuable advice for further modification of the index later on. The camps adopt an innovative work cafe model that encourages every participant to share their experiences with no fear of being judged or punished. Some enterprises did share very good examples for others to learn from. On this side, you can find some good examples. They also gave the department inspiration of revising and adjusting indicators and benchmarks for the index. In this way, the challenge camp serves a dialogue channel between the government and the enterprises for modifying the index and also building a trustful partnership. In December of 2018, the first version of the index was released. It is the first one of its kind in Asia. Main purpose of the index initiative is to encourage enterprises implements concept of respect, inclusion, diversity, and freedom from discrimination and bias in the workplace. It consisted of 7 indicators with 28 benchmarks. They are mechanism and education and training to promote gender equality, measures to promote gender equality in decision-making position, salaries, work-life balance, and support childbirth and child rearing, safety and friendly measures to promote gender equality. Shortly afterwards, Taiwan legalized same-sex marriage in May of 2019. The indicators expand to 7+1. The 8th indicator, it refers to other LGBT plus friendly measures in the workplace, especially, and those not concluded in other indicators. As we all know, the pandemic has dramatic change about the way we work and increased burden of family care of employees, particularly to women. Later on, I will present practices from awarded enterprises, especially based on the indicators of measure to promote work-life balance, which is quite important at the moment of the pandemic. Okay, here are highlights based on the indicators from awarded enterprises during 2020 to 2021. In 2020, due to proactive prevention policy applied in Taiwan, the pandemic situation was not severe like in most other countries around the world. Nearly half measures are about how to assist employees to maintain work-life balance when they have kids or families in need of care. The other half are about offering employees leaves better than related laws and regulations. Among them, some are COVID-related ones, such as paid epidemic prevention leaves or extra family care leaves not included in personal leave. In addition, some provide employees with flexibility of working schedule and locations. Employees could choose to work from home or with flexible hours. Moving into 2021, awarded enterprises expanded the measures since Taiwan was caused by the UK variants and moved into level 3 of the alert system in May. More and more people become eager to get vaccinated. The enterprises choose to offer paid COVID-19 vaccination leave for employees if they had side effects after vaccinated. There was even an enterprise that took mental health of employees into consideration. It organized online lectures on topics like how to manage parents-child relationship during the COVID-19, live peacefully together with the COVID-19, and you can feel at ease whenever you work from. They are all good practices, showing employees supports and care for their employees during the pandemic. Facing the COVID-19, in addition to what enterprises have done in the certification initiatives, central governments and city governments has launched other initiatives and policy for people in the country and the city. For assisting those negatively affected by the COVID-19, central government launched Peace of Mind Employment Plan in April of 2020. Residents of Taiwan and foreigners who have been underemployed or unemployed due to the pandemic situation will be provided with job opportunities at public sectors and subsidies according to the plan. Secondly, if employees could ask for unpaid vaccination leave not included in the record of absence. And schools and kindergartens were closed due to alert level going up to level 3 in 2021. Employees who have families affected by the pandemic and in need of care could ask for unpaid family care leave for 7 days a year. As a local government and capital city of Taiwan, in order to help employees of the governments maintain balance between work and family, city governments expanded measures for flexible work schedule. Before the COVID-19, flexible hour was 1 hour, and employees should check in for work during 8 to 9 a.m. Then it expanded and become 7 or 7:30 to 9:30 a.m. They are what government did outside the certification initiative. And these are pictures of press conferences on certificates issuing. Deputy Mayor Tai and Commissioner Chen together issued certificates and awarded medals to the 7 enterprises out of 49 in the past 2 years. Their involvement shows not only their support for the government's efforts, but also determination to promote gender equality in the workplace. Just quoted words from the general manager of an awarded company in his acceptance speech. He said, receiving certificates is just a beginning. We will keep it up, doing our best to implement gender equality within workplace. We'll take up social responsibility and take care of every employee in the company. Okay, to conclude, in the initiative, Taipei City governments use strategies, listen to the enterprises, offers incentives. Awarding is encouragements. Encourage them to take gender equality as a core value in management. It is even more than awarding. It is about process of the government working closely with private sectors in hope of affecting individuals, families, and enterprises to finally create a civil society with diversity and inclusion. The COVID responsive gender equality practices are not something different from the indicators in the initiative, but an upgrade from what enterprises have already done. We will keep promoting the initiative and updating the indicator based on experiences of running the initiative, and hope to see more and more enterprises join the certification and strive for a gender equal and friendly workplaces together with us. That brings me to the end of my presentation, and thank you for your attention. I'm looking forward to discussion. Thank you.
Thank you, Ms. Holmes, for your presentation. I think like what Dr. Yan had mentioned, it's like really crucial that government plays a role. So it's very great to have you share the government perspective of what they did before COVID, but also sharing like best examples from the government, like government and private practice partnerships that have worked together to implement. So I think that's very important. So our next panelist is Dr. Daisy Fan. Dr. Fan received her PhD in sociology from the University of Texas at Austin. She is currently an adjunct assistant professor at the Taipei Medical University, specifically at the Graduate Institute of Humanities and Medicine. Her research has focused on understanding determinants of psychological well-being among different age and gender groups. Recent years, with her experience of taking a career break to care for the family, she is particularly committed in supporting expectant families and advocating for work-life balance. Her presentation today will share results from a survey on family relationship during the COVID-19 lockdown in Taiwan. Let's go ahead.
Okay, Helena, thank you so much for your wonderful introduction. So far, we've heard many wonderful and insightful theories, ideas, and applications on gender equality. Now I'm going to present an evidence-based survey looking at family relationship in Taiwan. Okay, so what's special about Taiwan? Well, Taiwan is only 18 miles from the coast of mainland China. But the pandemic was generally very smooth, except for May to July last year. At that time, we had community spread. So the government kind of enforced level 3 alert. So the schools were closed and many people started to work from home. And we conducted the survey in August, just looking at people's experiences for the past few months. Before entering the survey, I want to give you some basic background about Taiwan. We've got about 23 million of people in Taiwan. We're very small, but we're energetic and hardworking. In fact, Taiwanese workers have the 4th longest working hours in the world, according to Ministry of Labor. And females labor force participation has been increasing for the past decades. However, traditional gender division of household labor still exists. So many women, especially employed women, they have to take care of all the many of the household chores, even when they leave their work. That's so-called double shift. So we were kind of interested to know with the COVID and many people are working at home, will that kind of a challenge or make some changes on this gender-based division of labor? Okay, by the way, this survey is conducted and sponsored by Frontline Corporation. It's a human resources social enterprise based in Taiwan, advocating for work-life balance. So, as I mentioned, this survey, this is a self-administered online questionnaire targeting only people who are currently employed across different age, position, and income groups. In terms of characteristics of the survey respondents, we got about 73% of female and 27% of male. And many of the respondents are married, and they have relatively high educational level. And based on their monthly income, we can kind of conclude that the respondent in this study, they are in middle class and they are, people who are relatively better off. Okay, so let's go to the results section. I always like to start from the good news. In terms of parent-child relationship, about 60% of respondents reported that their parent-child relationships actually improve or getting better after working from home. Mainly because they got to spend more time with their kids and they got to, create more shared memories with their kids. How about spousal relationship? Well, we've got about 1/3 of respondents reported an increase in spousal relationship. However, there's something very interesting in terms of gender differences. Okay, so we've got about half of males reported that their spousal relationship were getting better. However, only 28% of their female counterparts believe so. So we can see a gender difference here. And if we further break it down into age, income, and occupational status, we can see a very, very interesting story. So this is a bar chart looking at percentage of male and female reporting an increase in spousal relationship. So what can you see here? Okay, first, the purple bar is female and the white bar indicates male. You can see that across different age, income, and occupational status, males are more likely to report an increase in spousal relationship. So why is that? Well, it's very hard to answer this question, but a line of research in sociology indeed indicates that men probably gain more from marriage. In other words, they probably get more psychosocial resources in marriage than women. For example, they might get more emotional support and instrumental support and etc. Next, we're going to look at household division of labor so that we might have some idea about this. Okay, so next question was asked, do you have anyone to share the loading of caregiving and household chores while working from home? The answer ranges from no one, no help, alone, to I've got help from spouse or partners or help from other adults. So here we're looking at division of household labor by age. Okay, so the lower portion of the chart indicates no help, and the middle purple portion means with help, with help from spouse or partner. Now you can see that there's a sharp contrast between older male and older female, in the sense that 26.9, almost 27% of females, older females, reported that that they have to do all the household chores alone with no help. However, only 9.4 of their male counterparts have to do all the household chores alone. On the contrary, you can see that for older males, 63.5% of them reported that they got help from spouse, but only 33.5% of females got help from their spouse or partner. Now, again, I further break it down into age, income, and occupational status. Again, here, white bar represents male, and purple bar represents female. Okay, so the trend is very interesting because you can see that women are far more likely, about 2 to 2.5 times more likely to take care of household tasks alone. And it's important to know that there's no exception for high income and females with high status. In other words, even females, they earn more and they have higher status. They are still more likely to take care of household chores and caregiving alone than their male counterparts. So the final question was asked, do you take on more household chores while working from home? Okay. For presentation purpose, here I only compare respondents who reported that their household chores increased a lot while working from home. Here again, we can see a sharp contrast between older male and older females. And then when I break it down into income and occupational status, you can see that high income and high status women are still more likely, actually they are the most likely group to report their household chores increase a lot. So high income and high occupational status don't necessarily give them resources or negotiation power, to prevent them from doing more housework. Finally, we're looking at marital status. And you can see that there are 27% of married women reported increase on household chores versus only 13% of single female reported of increasing their household chores while working from home. So see, there's another contrast between married female and single female. But there's not much difference between married men and single men. Okay, so if we take all these results together, we can find something. That is, the most disadvantaged groups on household division of labor are females and people who are married, and those who are 45-year-old, and those who have higher status and high income, especially women. Okay, so here we move to the discussion part. What do we actually learn from this study or this survey? Well, we expected something different in terms of gender division of labor after working from home. Unfortunately, it seems to us that gender inequality remained during the pandemic. Also, we found that employed high-status women do not necessarily have more negotiation power on household tasks. Well, at usual times without COVID, they might have more resources to buy outside service, like nannies or housekeepers. However, with COVID and everyone's working from home and social distancing, their resources are not that useful. In other words, they are still more likely, to take on household chores alone or take on more household chores. So more resources among women doesn't necessarily equalize to fairer spousal relationship. But the situation is totally opposite to male. Based on the bar chart that we've shown several minutes ago, you can see that males with more resources, in other words, males who are, who earn more or who have higher status, they have more negotiation power to not to take on household chores, or they have their spouse or partners to do that for them. That's very interesting. Here we also find something called cohort effect. We can see that the gender gap are largest among older generations. Okay, based on the result that we just presented, I think it might provide some insights into gender equality in Taiwan. Well, in fact, we're doing really great in terms of gender equality in public domain. We are among the top of gender gap index in Asia.
Sorry, Daisy, sorry for the interruption. You have 2 minutes left for your presentation. Please go
Okay,
ahead.
thank you for the reminder. Thank you. And we are the first Asian country to legalize same-sex marriage. We even have female presidents. However, gender equality in private domain still needs a lot of work. We can see that employed women, they undergo like double shift, and then if they cannot resolve work and family conflict, it might eventually lead to their exit of labor force. We have to notice this is not just a domestic issue. Women are considered valuable labor force. So losing them would be a great loss to the whole country. And it might also indirectly lead to low fertility. Okay, so what can be done? First, we can find some ways to empower women. Something that's most critical is to have more women to be involved in policy making at different levels, because women know what women want. And we also have to be more cautious about the ideology or discourse of perfect woman or perfect mother. In Second Find, we actually have some workshop designed for the public, especially women, to help them to develop self-awareness and know the social context so that they can set up their goals and go forward to it. Okay, so another important point is how do we provide incentives for men to participate more in household chores and caretaking tasks? I have to emphasize that this is definitely not an individual issue. Well, so I don't mean to blame on men, because this is not an individual issue. This is definitely a structural and cultural issues. And policies matters, because policies may reinforce or reduce traditional gender division of labor. For example, longer period of paid paternity leave may be helpful because it might set a foundation more equal distribution of responsibility on childcare at a very early stage. And it might eventually lead to, better gender equality in the household. And finally, I think an opening organizational culture and having a role model for men just to may be able to make men feel they have the freedom to balance out and to focus more energy and time on their own family. So this concludes my presentation. Thank you very much for your listening. And you have any question or comment, please feel free to email me. And I'm so looking forward to the discussion. Thank you.
Thank you, Dr. Fan, for your presentation. Thank you for sharing the specific results that are highlighting the trends and changes we see at home as a result from the lockdown. It definitely kind of echoes the previous presentation of the persistent structural inequalities that we continue to see at the household. Our next panelist is Ms. Alice Chen Shuang Chen. Ms. Chen worked as a registered nurse at the infectious disease ward at the National Taiwan University Hospital before COVID, so since September 2018, taking care of patients with HIV, tuberculosis, influenza, etc. She has, since the pandemic has hit, she has been working with the COVID patients for over 2 years, and when her ward was specifically transferred to dedicate to the COVID patients since January of 2020. In her presentation today, we'll provide tips of maintaining work-life balance as a COVID frontline healthcare provider. Please go ahead and take it away.
Sorry, please open your mic. We cannot hear you. Yeah, thank you.
Okay, sorry.
Yeah.
Okay, excuse me. Hello, everyone. My name is Chen Chen. You may call me Alice. I'm a registered nurse working in the infectious disease world at National Taiwan University Hospital. Today, I'd like to talk about tips for nurses on the front line to maintain work-family balance during COVID-19 pandemic. Okay, first, let me begin with a brief introduction about the infectious disease world I work in. We take care of patients with infectious disease such as HIV, TB, influenza. And back to 2003, when the SARS outbreak occurred, the ward was transferred to SARS dedicated ward for 6 months. After 17 years, when COVID-19 outbreak occurred in January 2020, the ward has been transferred to COVID-19 dedicated ward until now. There are 22 members, including 1 head nurse and 21 registered nurses, 20 females and 2 males. There are 9 who have been nurses for over 20 years, and they had been through SARS in 2003. So COVID is the second serious pandemic that occurred in their career. I think we are lucky to have these senior nurses who guide us from the beginning until now. And let's take a look at our unit first. There are 15 out of 22 nurses who are single. The 7 married nurses have 12 children in total. There are only 2 nurses who have to take care of children under 18 years old. As nurses, we need to play a lot of roles at the same time. At work, a nurse for sure, and maybe a preceptor to teach nursing students, new nurses, or nurses from other units, or studying as a graduate student but working at the same time. And at home, maybe a wife, a mother, a daughter-in-law. We already played a lot of roles before COVID. So when COVID-19 occurred in 2020, some new stresses came along. About work stresses, first one, physical discomforts. We need to wear N95 masks and PPE for a long time, so we cannot drink water or go to the toilet at any time. Some people got pressure injuries from wearing N95 masks. During summertime, wearing PPE is really hot. Every time we come out from the isolation rooms, like we just come out from a swimming pool, so sweating. We need to change clothes and drink enough water in case we may be dehydrated. Second, involving information. Many things related to COVID are changing at any time, such as quarantine policies, the isolation criteria, new drugs for COVID, or other guidelines. So we need to learn new things quite often. Next one, workload. Not only care for patients, we need to help train nurses from other units and train the resident doctors work in our unit every month. We also support the screening stations in our hospital. And next one, risk of infection. Even though we follow the guidelines to protect ourselves, but taking care of COVID patients, we still have a risk of infection. And the last one, emotional distress. We need to be with patients alone most of the time because patients' family or friends cannot accompany them like usual. Some of them were unhappy about quarantine in the hospital or felt stressed about the disease or physical discomforts. And we nurses are the people who stay the longest time in the isolation room, so we have to face the patient's feelings and comfort them quite often. And let's talk about family stresses. First one, disturbed family routine, like homeschooling. Some parents could also work from home during homeschooling period, so they could take care of their children. But we couldn't work from home, so how to do with kids homeschooling is a problem. And the next one, concerns about question. We have a risk of infection, so if we are infected, then our family who have been in close contact with us are requested to quarantine. It may affect a lot of people and worried about loved ones being infected. Our family will worry about us working in the dedicated world having a higher risk of infection. And we have some vulnerable family members like kids or elderlies. And like one colleague's siblings told her not to go home because her mother is over 70 years old. And so her siblings were afraid she may infect her mother. Something like that, yeah. And next one, strong uncertainty. It's like don't know what will happen in the future. And the last one, associative stigma. Some are afraid of others knowing their family members are working in the COVID unit. Like one colleague said her husband is afraid that his colleagues may know that she's working in the COVID unit. Because if his colleagues know, then her husband will be asked to work from home. And two colleagues who have daughters under 18 years old told their daughters not to tell their friends or classmates that their moms are working in the COVID unit because they are afraid that their daughters may lose their friends because of their job. So with these stresses above, then how can we maintain work-family balance? I'm gonna share some tips from our members. Tip 1, invest in self-care, healthy and happy foods for sure, and enough sleep. And exercise regularly. It's very difficult for many of us, especially because sometimes we already find ourselves tired after work, but we will encourage each other to exercise. Under level 3 COVID-19 alert last year, we couldn't go to gyms, so we tried to work out indoors and doing workout along with YouTube videos. And last August, we started a badminton club with 9 members in our unit, so we will play badminton at least every 2 weeks. And find ways to relax, like massage, yoga, watching drama, having good hobbies, exercising, painting, cooking, gardening, and take care of yourself is the most important tip from all. Yeah, and let's go to tip 2, growth mindset. First one, focus on what you can change. That means let go of things you cannot change and focus on what you can change. For example, because of COVID, we have taken care of many foreign patients, but some members in our unit are not fluent in English. So we made an English version of nursing assessment and other common daily conversation to make it easier and faster for them to take care of foreign patients. We cannot change the fact that we have to care for more foreign patients, but we can make a change to help the process go smoother. And be flexible. Policies and criteria change rapidly. Sometimes it becomes totally different in just a day or just a shift. So be flexible and use humor in a positive way will make work more enjoyable. Last one, be grateful to colleagues, to supervisors, and to family members because there are many things we cannot accomplish by ourselves. And let's go to tip 3, good communication and cooperation. At work, speak with supervisors and colleagues. It's important to speak with supervisors or colleagues when facing difficulties at work because it may relate to patient safety or our nurses' safety. So ask for help is very important. When we are in the isolation room alone, we may need help from the outside. Like if I forget to bring something I need or I cannot handle the patient's condition by myself. I have to call out for help. On the other hand, I will check in with my colleagues to see if they need help. Good communication, good teamwork. At home, talk with family members. Family will worry if we have enough protection when we take care of COVID patients. So we would explain we have enough PPE, we have the complete guidelines to take care of patient, and we do a PCR test every week to make sure we are not infected. And rearrange family routine. For example, during the homeschooling period, one colleague sent her daughters to her parents' house back to in Zhanghua, like that. Yeah. And last one, express love in many ways. Before COVID outbreak, I think I expressed love to my family more in numberable ways, like hugs or accompanies. But after the COVID outbreak, I sent texts, stickers through app to my grandma and told her I love her because I couldn't see her often. And it's a new experience I appreciate. And talk about express love in many ways. Let's go on to tip 4, connect with loved ones. First one, send boundaries between work and home. Our unit has a chat room to share news of work, so we try not to check the world chat room when spending time with family, because sometimes they may be different after you go back to work. Try not to be too involved after the shift is finished. Yeah, and family time for sure. Find some time to get together, share lives together, and alternative meetings. Not only family, but friends. Thanks to technology, even families or friends can get together in person. There are still many ways to have fun together. During the level 3 alert last year, I played drawing and guessing games and mahjong online with my friends, and one colleague sang karaoke online with her friends. Spending time with friends is a good way to share and get support. So tip 1 to tip 4 is personal, and tip 5 is for organization. Take National Taiwan University Hospital as an example. How to create a supportive work environment. First, provide adequate training. Like donning and doffing PPE and a lot of guidelines to take care of our patients in the isolation rooms. Because we are the infectious world, so we took the test of donning and doffing PPE annually before COVID-19 occurred. But to care the real patients was the first time for many junior nurses. At first, when junior nurses like me entering the isolation room alone, there would be senior looking after me through camera. And if I did anything wrong or anything I didn't notice, they would tell me. And I felt safer to have my seniors looking after me at the beginning because I was nervous that I might forget to do something important or contaminated my PPE or the environment unconsciously. But like the reason that the seniors could have time to help the juniors is based on safe staffing. So the second one, safe nurse staffing. Some may heard like safe staffing saves lives. Safe staffing improves patient outcomes and prevents nurses burnout. And communicate clearly and often with staff. Know the staff's needs and what you can help them is very important. And motivate employees. Our head nurse has shared a lot of positive feedbacks from patients, family, or friends to let us know we do a good job. Yeah, and she helped members collect our achievements to see how much things we have done during COVID pandemic. Yeah, and the last one, provide both material and mental support. We have received many different supports from many departments in the hospital, such as free PCR test every week to make sure we are not infected. And from the Center for Infection Control, they gives us many guidelines about COVID, or if we had anything about COVID, we have to ask. We will contact them. And the General Affairs Office provide a PPE supply and offer dormitory for health workers working in the dedicated world. And Public Affairs Office collect things donated by the public, such as foods, drink, masks, PPE, cards, like the cards on the right side. This card we received from the public during the level 3 COVID alert last year. And social work office provide necessities for us like toiletries, snacks, or if we want someone to talk to, we can call them. And The Clinical Psychology Center also provides mental support, and they will hold activity like how to be resilient or how to cope with stress under COVID. So in summary, creating a supportive environment needs a lot of help from many departments in a hospital or an organization. And compared to SARS outbreak, the COVID-19 pandemic lasts for a longer time, and we don't know when everything will be back to normal. So playing multiple roles may have multiple challenges. Based on our experience, tips for frontline nurses to maintain work-family balance during COVID are invest in self-care, growth mindset, good communication and cooperation, and connect with loved ones. For organization, create a supportive work environment. There is no perfect work-family balance, but if we try, it may be possible. Thank you for listening.
Thank you, Ms. Chen. Well, first of all, thank you for your continued service in the front line, and thank you for sharing for your perspective of some and focusing specifically on mental health tips that are often neglected. So thank you again. Our last but not least panelist is Ms. Cynthia Zhang. Ms. Zhang is the Chief Operating Officer of Medias Fund, a private equity fund in Asia, and is the board member of Taipei Awakening Association. She experienced in women rights revolutions and gender equity. Her presentation today will share an NGO's perspective of helping economically disadvantaged women during the COVID-19 pandemic. Please go ahead and take away.
Hi, good morning and good evening for everybody. Yeah, it's Cynthia here. Today, I would like to share some experience I go through with how we assisted the disadvantaged women during the COVID-19 pandemic. Right? Yeah, I will share the two major ways of the impact. One is economic impacts, the other is unpaid care work. Okay, see the economic impact. This is how we download from UN Women statistics. Okay, for the globally, women share 58% work, and although that men share 63%. And okay, it's from South Asia. It's the employment that the women of South Asia will be 91%, and for Latin America will be 54%. Okay, so through this COVID-19 impact, that we found that women spend three times more than men, okay, for the labor force, okay. All right, you can see here, this some countries we analyzed that, okay, the woman work fewer hours, and then see that the man, like Thailand, we can see that the woman lost job more than the man. Okay, even almost in each country. Okay, and okay, let's talk about the unpaid care work. Okay, that's an informal way of the man. The work, you can see that the woman did nearly 3 times as much unpaid care and domestic work as men. Okay, we just discussed from the other former speakers. Okay. I think the main reason is because that when the pandemic appeared, the school closure and the healthcare systems shut down. So it's quite, in Asia country, that women need to share more housework job and take care job at home. That's why I think that's why 3 times as much as men. Okay. Let's see that. This picture is showing that if we accumulate that unpaid care and domestic work performed by women for this sustained society, okay, you can find that women spend 4.1 hours per day, although that the men just spend 1.7 hours per day, which is almost 3 times, from women and a man. Okay, so if we accumulate all this percentage, which is 2.35% unpaid contribution to healthcare into the global GDP, which will be 1.5 trillion US dollar. Okay. And if we total or include not just healthcare, all the unpaid contribution from women, it will be 11 trillion US dollar. It's a very huge amount. Okay, so actually during this, some people will ask us, how can we help this disadvantaged women, especially during this COVID-19 pandemic period? First of all, one of our project will be help these disadvantaged women how to make clothes, how to make bags. So during that period, we found that face mask is very hard. It's very hard to get. So we try to make the clothes instead of paper face masks. Okay, and even though we teach all these women work at home how to use their clothes made into face masks, and we also teach the women in Nepal. We send this skill go abroad to teach the Nepal woman how to make it. Okay, because they also suffering from COVID-19 pandemic at the time. Okay, and this is how we try to ask them to work from home and make more clothes masks. Okay, or instead of working at our office. Okay, this picture shows that we negotiate with our vendors and our the corporates who place the order, and to convince them to accept that we can postpone our delivery a few days later. And we also, because there's a lack of the orders because of a lot of enterprises also have some bad impact of this pandemic. So we teach this disadvantaged woman from the learner to the teacher. Okay, they try to teach the other group how to make a facial mask or make towels or make bags instead of they make by themselves. Okay, they turn into a teacher and go into a lot of group and society and encourage them to do that. Okay. And this is one of our the other project of our. We also are the center of caregivers. So we help them to help the take cares online. We teach them how to do that online instead of face-to-face teaching, because from that time we might not go to the personal house in person. So we we try to get some notebook for them, especially this disadvantaged women. They might need to have sufficient conditions to get the notebook or PC. So we try to help them to get the MP and teach them how to do, how to operate the notebook. Yeah. So overall, that from this COVID-19 pandemic, we disadvantaged women, we try to find from some other way to help them, and they turn out to find themselves more confident because although this hard time, they didn't lose a lot, and they get more from this period. Okay. So far, this is my speech. Thank you.
Thank you, Ms. Zhang, for your presentation. We definitely know that there's a gap that NGOs fill, and so thank you for sharing the unique experience of how your NGO was able to help a disadvantaged woman. I know we're pressed for time, so I don't see any questions in the chat box, so I'll just limit one question per panelist. So actually, I'm gonna go back to Ms. Zhang about your presentation with NGO. So from your experience, and what do you think your organization would benefit from government partnership and is continuing to assist economically disadvantaged women during the COVID-19 pandemic?
I think that Taipei City government help us a lot. Yeah, in some ways, no matter in the fashion show, they ask us, they ask our members to join, and the mayor, at that time that the mayor wear that suit was made by our members. So we highly appreciate of Taipei City.
Thank you for your response on sharing more detailed of how like government partnership is able to work with NGO partners to continue with their effort. So go on the, on the trend of government and private enterprise, Ms. Tiffany Hong, I was wondering if you could, so I noticed some of the best practices are, correct me if I'm wrong, like they're generally private entities that are on a bigger size. So I was wondering if, what is like the city government's like efforts to, I guess, like reach out to more like smaller entities that are actually having like for like informal workers to establish that successful partnership for gender equality. Can you give us some encouraging tips?
Okay, thank you for the questions. As to the question, I just like to get back to the initiative in my presentation. To be honest, to see all the applicants during these 2 years of running the initiative, we could see that totally there were 49 enterprises applying for the certification. We have to be honest that the proportion of the smaller enterprises is comparatively small. Because based on the statistics we have, enterprises with employees under 100 only consist of like 8% of the applicants, and employees of 101 to 200, the proportion is around 18%. So actually how to involve them to our initiative and to build the partnerships with the governments is at the moment is the question we face, and we are thinking that how to offer much more incentives to involve them. We also got some advices from members of Gender Equality Commission of the Taipei City, and to advise us that to consider adding incentives for those smaller enterprises to participate. So our departments of labor, they will think about it and maybe make some adjustments after we collecting more feedbacks. And we will keep on promoting the certification initiative, and like to through different platforms or channels, and just try to involve those smaller enterprises more into our projects. Okay, that's my answer to the question.
Yeah, thank you for, like laying down like the realities of reaching out to smaller enterprises, but also showing like the initiative the city government is trying to tackle that to reduce the barrier and provide more incentives. My next question is going back to like the frontline perspective. So for Ms. Chen, so thank you for sharing like, mental health like tips, which is very undermined oftentimes when we talk about like health, like self-care. So I definitely appreciate that. But it seemed like most of the responsibility of the support seemed to rely on like the individual or like the immediate team. So I was wondering if you can share more systematic like support from the hospital, whether like there's like additional pay leave. And for instance, like in the US, there's a lot of like nursing shortage and burnout. So like, can you talk more about like the systematic support that either like happened that you didn't get a chance to highlight, or you wish like, the hospital or like the government entities were able to provide to ensure there's like a healthier work-life balance as a frontline worker?
Okay, thank you for your question. We don't have a pay leave, but if we could have it, would be great. And I think about the safe staffing thing in our hospital, we never felt that we have shortage on staffing. Yeah, and if there is anything we think it will be great to have, it may be like one colleague said during the homeschooling period, it would be convenient if the hospital could provide a daycare center for children under 18 years old, because she and her husband both had to work, and if she didn't have her mother-in-law to help her, then it will be difficult to take care of her 11-year-old daughter. So if the hospital could provide a daycare center to take care of children, like not only for our dedicated work, but like all the members in the hospital, especially nurses, we need to do the shift. So it would be great to have, if we could have a daycare center for children during the homeschooling period. Yeah, and other systematic problems, I think we're lucky enough to have like everything we have right now. So that's it.
Well, thank you for being like honest. Sorry to put you on the spot on like your entity, but I just think like, oftentimes, especially like in the Americas, like I think at the beginning we've put a lot of focus and thankfulness like to the frontline workers, but we can easily forget since the pandemic, like you said, it's unknown like how long it will last. So Thank you for, suggesting very practical solutions. And I think this is like a point that Dr. Yan has mentioned, that that's why it's so crucial that the government has to step up to implement, whether it's like policy, but also enforcement. So my next question is for Dr. Yan about gender responsive recovery policies. Can you share some, I guess, like encouraging like trends or promising policies that are currently in progress in Taiwan?
I think that's really a hard question. That's why I propose the gender responsive job reach recovery policy. I think we only have a child care school support, but it's only limited to certain people, the people in public sector. I think during the pandemic, COVID-19, then the public sector is really taking like a 2 shift. One group is working from home, one group is at a workplace, right? So the daycare will open for the public sector workers, right? Am I right? I was right. So that's opening. So I don't think we have really promising. Don't take me wrong, because I'm the critical sociology professor. So that's why I suggest gender responsive job reach recovery policy. And especially the policy need to counterbalance the gender specific. We have a lot of policy, looks like it's really great, but it's really for everybody, but it doesn't fit to everyone. So gender specific policy, especially we need to coping with the effort of a COVID-19 crisis, to the informal sector. As I remind a couple times, informal sector is really the one have the great impact on them. They probably just left the labor market forever, never come back. So that's why I say I'm privileged to be here to share this kind of thought or promote gender responsive policy. So I feel so sorry those disadvantaged group, they cannot be here. So as a social practitioner, they should advocate for their needs, not just, it looks like we're only talking about middle class professional level. And I think in this event, the COVID, the pandemic, for middle class, not really impact that much. They get paid regularly. But the people who are locked down, the lockdown measure is especially important. But I don't think a government official was listening. So because this is NGO, so I don't think I have a good answer for this. Maybe next year.
Maybe next year, hopefully.
Okay.
Well, but I think it's very critical to have like gender specific, like critical of like what exists, what are actually working and what are not actually working, and continue to push that government to, to do better, because obviously they can have a significant impact. And if they're not listening, then we're left to regress from our previous progress. Last but not least, Dr. Fan, I know you specifically focused on, the actual like survey of like family relationship changes during the lockdown. And I think you also conceded that, the survey is limited to mostly like middle income family. And you mentioned, at the disclosure that this was sponsored by Seek and Find. And I was just wondering, based on the survey results, like how does the organization plan to incorporate the survey results to their advocacy for work-life balance?
Okay, Helena, thank you for your question. According to the results of this survey, we find that there's still a gender gap, a major gender gap in terms of household, the division of household chores. And this might hinder women's pursuit for career, and they might sometimes feel that they're overloaded or trapped in this kind of unfair, division of labor. So what we're trying to do is actually we're doing both sides. One side, we're having, workshop or support group for women, especially, women like who are looking for going back to, to the job market. So that the purpose for the workshop or support group is just to make them feel like they are not alone, because many people are at the same situation as they are. Also, we try to develop some kind of self-awareness and make them to be more aware of the real social conditions so that they get more prepared to go back to the job market. That's something we do for the public. On the other hand, we're doing something for the companies or corporation at the same time. We're trying our best to, to show them or prove them, focusing on or investing on, the policies on the balancing of family and job. Just investing on those kinds of policies will be eventually beneficial, not only to the employees, but to the corporation themselves. Because if the workers or the employees can achieve a balance between their work life and their family life, they might be more productive and they'll be more dedicated in their job. So that's something we've been doing. We're doing both sides.
Thank you for sharing what the organization is planning to do to continue with the work of work-life balance. So I think I think we're 10 minutes over the time, so I want to conclude the event, and thank you for all the panelists, but also participants to join on this event, and hopefully, unfortunately, like the picture seems pretty grim, but hopefully we'll continue to make sure and remind everyone like how crucial it is, like we shouldn't fall behind the progress. And we look forward to next year to see if there's any little bit of progress or more exciting news to share. I see that there's a question, Dr. Yan. Dr. Yan, we can't hear you.
Yeah, I'd like to thank for May. May is really invited for the first panelist for us. So thank you, May. I know you are online. Could you open your video and say hi to us? Hi, May. Okay.
Well, yes, and sorry, I forgot to mention, yeah, thank you for our two sponsoring organizations and like the staff that are behind that put in a lot of planning and organization and like testing during this like virtual world. So thank you. Is this May who's helping secure the first guest? Thank you again for your efforts. Really appreciate it for bringing an amazing guest to provide the EU perspective. Do you have a few words you want to share? I believe you're on mute, May.
Sorry, we cannot hear from you. Okay, we see you in Taipei. Bye.
Any last impressions or conclusions that any of the participants or panelists want to share with everyone? Okay, I think that's it. Thank you again very much. I know it's like midnight in Taiwan, so thank you for staying up to participate. And thank you again for the organizations and also obviously like the hardworking staff for organizing everything and of course the participants. Hopefully we have some good news like next year a little bit. Have a great one.
Sorry again, could all the speakers open your camera? Can we take one more group shot? Group photo again? Thank you. Yeah, thank you. Okay. Okay, say cheese. Yes. One more. Okay, say cheese. Very good. Thank you. Thank you all.
Thank you all. Have a great one.
Thank you. Thank you. 谢谢两位。哈，很热的。我们整个还。